An estimated 13% of children enrolled in Medicaid have been diagnosed with Attention Deficit Hyperactivity Disorder, or ADHD, which is a common neurobehavioral disorder. A new national report by the HHS Office of Inspector General found that many Medicaid-enrolled children with ADHD did not receive recommended follow-up services. Here's Regional Inspector General Brian Whitley to explain this report.
The major finding in our ADHD report is that over 500,000 children that were eligible for Medicaid and were newly prescribed an ADHD medication, they did not receive the recommended follow-up care.
The report discussed timeframes for the lack of follow-up care after children were prescribed ADHD medication.
We found that 59% of those children didn't receive the recommended follow-up care within 30 days, and 21% of those children didn't receive recommended follow-up care within 300 days. So that's almost a year that those children were on an ADHD medication, but did not have a doctor's appointment. And so nobody was there to follow up with them to make sure that dosage was accurate, that there weren't any side effects, and that the children were responding well to medication.
The report also broke down the different types of recommended care often not provided to these children, including follow-up care after hospitalization.
About a third of the children did not receive any kind of follow-up care from a physician a month after they were discharged from the hospital for a condition that required that.
What can be done to address the problems identified in this report?
OIG recommends that CMS collaborate, assist, and analyze. We ask that CMS work with its external stakeholders, such as the American Academy of Pediatrics, to identify barriers for children receiving follow-up care, as well as identifying long-term goals and success metrics. We ask that CMS assist states with technical specifications to ensure that children are receiving the services. And then we ask that CMS analyze the efforts that they have taken.
Whitley emphasizes the importance of follow-up care for children treated with ADHD medications.
It's very important to receive follow-up care. Children with ADHD often have difficulty in school, and sometimes they have difficulty with the criminal justice system. Children that receive treatment for ADHD will often be on a good path so that they can stay in school and they can have productive lives throughout adulthood.